Before any surgery, your anesthesiologist asks about your health, not to be nosy, but to predict how your body might handle anesthesia. There's a simple code they use, the ASA physical status. Let's decode it. Hi, this is anesthetics nerdy sidekick for your OR prep. Today we'll walk through the ASA classes, what the letters actually mean, how anesthesiologists use them, and what you can do to lower your risk. The ASA physical status classification is a short, widely used system developed by the American Society of Anesthesiologists that groups patients by overall physical health before surgery. It's designed to summarize medical comorbidities so teams can communicate quickly and plan care. Think of ASA as a ladder from healthiest to most critical. ASA 1. A completely healthy person, normal BMI, non-smoker, no systemic disease. Example, a fit adult with no meds. ASA 2. A patient with a mild systemic disease but no functional limitation. Example, well-controlled hypertension or diabetes, pregnancy or BMI 30, 40. ASA 3. A patient with severe systemic disease that limits activity but is not life-threatening. Example, stable ischemic heart disease, poorly controlled diabetes, or symptomatic COPD. ASA 4. A patient with severe systemic disease that is a constant threat to life. Example, recent MIs, severe heart failure, end-stage lung disease. ASA 5. A moribund patient who is not expected to survive without the operation. The surgery is typically life-saving, for example, ruptured aortic aneurysm. ASA 6. A brain-dead patient whose organs are being removed for donor purposes. There is also an E modifier appended to any class, for example, ASA 3E, to indicate an emergency where delaying surgery would increase risk. Important, ASA is a shorthand for preoperative health and team communication. It's not a precise calculator of your individual chance of complications. It doesn't incorporate the type of surgery, age in years, laboratory values, or urgent clinical details by itself. Anesthesiologists use ASA alongside other scores, tests, and clinical judgment to estimate risk and plan anesthesia. ASA along full risk calculator arts. The ASA scale is simple, which is its strength, but that simplicity also creates variability. Different clinicians sometimes assign different ASA levels to the same patient. Studies show only moderate inter-rater agreement, which is why the final ASA assigned on the day of surgery is often the anesthesiologist's clinical decision. Why does this matter to your anesthesiologist? ASA helps decide several things: how much pre-op testing is useful, whether to use regional anesthesia versus general, but monitoring and backup to arrange like invasive lines or ICU bed planning, and how aggressive pre-op optimization should be. A higher ASA pushes teams to prepare for complications and keep a closer eye on the patient. Good news, some risks are modifiable. Quit smoking, optimize blood sugar and blood pressure, lose some weight if advised, follow medication instructions, and be honest about alcohol and tobacco use. Small changes before surgery can move you down that ASA ladder and improve outcomes. ASA is a compact, powerful shorthand, not a destiny. It helps anesthesiologists see the big picture and prepare, but it's only one of many tools. Be open with your team, follow pre-op advice, and you'll give them the best chance to keep you safe. If this cleared up the mystery code, hit like, subscribe, and share. We'll dive deeper into pre-op tests and anesthesia types next time. Like, share, and subscribe for more.